Hello everyone, this is Dental Surgery Channel. My name is Nicolas Arona and I want to share with you the clinical map of every single presentation that you're going to be able to see in dentalsurgerychannel.com. So let's all review with this map every single one, giving you a little bit of information of each one of them. We're going to have a case that we need to place an implant in the aesthetic zone, and we are going to do an immediate GBR and also a connective tissue graft. So this presentation is very interesting because you are going to be able also to see the soft tissue management regards the GBR procedures and also soft tissue procedures. You all know how important it is to prepare the soft tissues whenever we are doing an implant case in the anterior area. So it's not only about the bone and the tone that it's set, but also the tone that is set by the soft tissues. We're going to have a case also that talks about implant placement in the aesthetic zone, where we actually suffer a complication derived from a non-cooperative patient. So it's important to know that we are not going to only focus our presentation, our cases, on fixing the solutions, but also on trying to discover and find out the cause of the problem. This is why Dental Surgery Channel is different from the rest, because we are going to biologically know from the A to Z why things happen in order to be able to avoid them. So in cases like this one, where we're going to experience a complication, we are going to know how, in this case, we manage that complication for a successful finish. Also, an immediate implant after extraction, immediate loading protocol. It's important to know that our patients today, more and more often, we're going to see patients in our clinic that require and are demanding these immediate loading protocols. And especially cases where the first premolar cases are clearly seen as a missing tooth in their tooth display in their smile. This is something that we need to know how to do it. We need to know how to apply those protocols to be predictable and to be able to manage those situations to provide the patient for the most advanced treatment. So immediate loading and immediate placement after extraction, immediate extraction and implant placement, it's something that we should today know how to do in order to be able to provide the patients with all the latest techniques. So in this case, you're going to see all the protocol that we follow in order to be successful. We're going to see an immediate extraction and implant placement in posterior areas. For the same reason that I'm telling you that we have patients today that require immediate loading after placing the implant. There are some patients that we know that by reducing times and reducing surgeries, we're going to improve the outcomes and also improve the post-operative inflammatory effect. So by using specific techniques, advanced techniques, we are reducing the number of surgeries and we are improving not only in our clinical service, but also in the results that we are going to have. Also, we're going to see a case where we did a guided tissue regeneration. It's not only about guided bone regeneration, but we are guiding the tissue to regenerate around the tooth. And how can we use Emdogain in a very predictable way to improve and to recover the periodontal ligament back? It's impossible to know that in this case, the patient developed a very severe infrabony defect because a non-plaque control during the orthodontic movement. And this is something that we need to take into account. Not only the combination of orthodontics with periodontics is important, but also that during those orthodontic treatments, we need to control the bacterial contamination. Otherwise, we're going to trigger the bone loss. So in this case, we're going to know the causes of the problem and how to use the best materials and the best clinical management and surgical management to have the best results. More and more often, we're going to see implant fractures, especially on external hex abutments and platforms. So it's very important not only to be able to remove the implant, but there is a protocol and there is a clinical decision process and clinical management of those cases that we need to classify in order to be predictable. Do we trephine the implant? Are we going to be able to untorque the implant directly? What if the implant platform is completely broken and we don't have advanced systems that would remove the implant very easy? So in this case, you're going to be able to see the clinical management, but also always finding the reason why the patient ended up having an implant fracture in order not to have a relapse, a new case of implant fracture. It's very important also to make smart decisions according to the classification. This will drive our decision-making process. We're going to have a guided bone regeneration in a severe 3D defect out of a premolar tooth loss that developed a severe periodontal problem that actually triggered the periodontal problem and contaminated also the periodontal ligament of the adjacent tooth, which was the canine. And how can we, using different biomaterials and different techniques to fix membranes, how can we be predictable? By using non-resolvable membranes, how to fix those membranes, whether we tag the membranes, whether we fixate the membranes to the periosteum. These are different techniques that are going to be seen also in the master classes here in Dental Surgery channel. An immediate instruction and immediate implant placement, the drilling protocol. As I told you before, talking about the other cases, more and more often the patients are going to need and are going to demand this kind of technique. So this is very important. In this class, I'm giving you the tips and tricks to be able to be predictable. One of the most important things is to know how to analyze the socket, analyze the alveolar area where actually the implant is going to be placed and the tooth is going to be removed. There's not too much bone there, but still it's enough to anchor the implant and even make immediate loading. So in this kind of case also, you will also see the drilling protocol that I developed by myself. And implant placement with tissue preservation zone management, it's because in the anterior areas, these are one of the most challenging areas. We do not want to interrupt. We do not want any papilla collapse. We don't want to move the zenith point upwards. We want tissue, we want papillas, we want like the original architecture, gingival architecture intact. So in this case, that actually it required an implant placement in the anterior area, in a central incisor. We managed a very big amount of bone loss and a very big infection without damaging that protected zone. You all know how important is the sinus lift and the sinus area. So in addition to those master classes, you're going to be able to have access to a sinus lift course, complete sinus lift course that will cover not only cases like the one on the left with immediate regeneration after the sinus lift, but also the complete knowledge of the sinus area, such as the anatomy, the blood supply, the innervation, and complications, and how to manage those complications, the antibiotherapy, determined antibiotherapy for the specific cases, and obviously a checklist and a predictable protocol to be predictable in your cases that I personally developed. So this would be the clinical map that we're going to have in Dental Surgery channel, and I'm very happy to say that we are going to be very soon open, and here you will be able to access to all the cases that we have, and periodically the cases are going to be updated, and obviously more content will be added. So I'm looking forward to see you here in Dental Surgery channel. My name is Nicolas Arona. I'll see you very soon. Bye bye.